most of the nurses I work with are gone in 1 to 2 years. But a lot of the reason that they're leaving is because they can't stay at the bedside, like mentally and physically, they can't stay at the bedside. And I think that that will never change unless hospitals invest in them and give them education and tools to make them feel more comfortable in what they're doing, and directly preventing some sort of, early burnout with them, and also giving the mental and emotional coping skills, because being a bedside nurse, a nurse in general, is extremely hard. It's pretty much thankless for the most part.
You are listening to the Pinnacle Podcast, where we empower women in medicine through education, community, and actionable strategies for both the practice and the business of medicine.
Medicine is a lifelong career, and continuing education is crucial for professional development. Pinnacle is the first and only multi-specialty organization dedicated to addressing the challenges that all women in healthcare face.
Welcome to Pinnacle, the elite professional community providing education for women in medicine. At Pinnacle, we challenge you to pave your own path by helping you develop the skills needed to not only stay in medicine, but to excel.
Welcome to the Pinnacle Prescription Podcast. I'm your host, Dr. Pamela Mehta, and today I'm joined by Danielle LeVeck. The topic today is nurse abnormalities, empowering voices in healthcare. Danielle LeVeck is a dual board-certified acute nurse practitioner and clinical nurse specialist practicing in a high-acuity cardiac surgery intensive care unit. She's been featured on multiple podcasts, written over 50 educational articles, and has contributed to The Strategist, The Daily, The Modernist, and Glamour. Upon becoming a nurse, she instantly recognized the beautiful quirks of nursing culture and healthcare in general. She was driven to share these stories and began her blog and online platform, Nurse Abnormalities, in 2015, which has amassed a following of greater than 150,000 engaged nurses and healthcare providers. She strives to inspire, empower, and educate the next generation of nurses to renew the previous generation. Danielle, I am so excited to have you as our very first nurse on the Pinnacle Prescription Podcast. We are so honored to have you. Thank you so much for being here today.
Thank you. I'm so honored to be the first nurse. I love it. I'm excited.
I'm excited too. And I want you to understand that this audience is probably going to be, at the beginning at least, mostly female physicians, but we are really trying to increase our reach because we at Pinnacle believe that all women in healthcare face the same struggles, and we are a place and a community to empower all women in healthcare. We make this so abundantly obvious, and I think having people like you come speak with us is going to be huge because we really do want to embrace our nursing colleagues, and we really believe that we have a unique set of hardships that men don't face, and so we will get into that later. But
yes.
First, I would love to hear your background. And maybe you could start with what inspired you to become a nurse and what your educational training was and how you got to such an intense practice area.
So I think that when you start interviewing nurses, you're going to find that a lot of us got here because of randomness. Like, most people love to hear that you were called to the profession. But in fact, I sometimes don't even know how I got into nursing. It just felt right. I thought it was going to be like a prelim career for me initially, where it got me into healthcare with a shorter degree. And then I would just move on to like either medical school or something. But whenever I got into it, I really liked it, and I decided to just keep going because I was enjoying how close I could be to the patients, and I saw what a difference I could make every day working and doing my clinical rotations. And so basically, I was drawn to the ICU because of the high intensity, and I just stayed there. And I've always been a person that operated well in a chaotic environment. And I think in a way it just felt like home, which is slightly dysfunctional, but maybe not because I realize that now. So I just kept going. I remained at the bedside for 7 years before I became a nurse practitioner. and then graduated as a nurse practitioner. I did go ahead and get my doctorate, which was 4 years, and then went to become a nurse practitioner in another cardiac surgery ICU, which is primarily where I've worked through my whole career, with a few like travel stints here and there. So here I am, but I'm pretty burnt out now, so I don't know much longer I'll last, but I still love the job, and I will always love the job. I can't imagine, honestly, that anything else will be closer to me. So we'll see how it goes in the next few years. But
well, it sounds like you went all the way when it comes to nursing. You chose the most intense field, and probably that's part of the burnout. I would love to just get into it. What do you think has contributed to your burnout, and what is different in nursing today than like 10 years ago?
So I think there are two main components. I've been thinking about this a lot lately, and you and I have talked about it as well. I think there are two main components that have basically sent me over the edge in my job, and I think I share them with a lot of people. Number one is having children. So yes. The first kid, I was doing okay. When I added the second kid, I was just like, these nights, weekends, and holidays and the 14-hour days are just becoming too much. And then the second component, which was a huge one that I didn't really recognize the impact of until recently. And when I say recently, within the last year, but that's definitely the change in staff after the pandemic. So once the pandemic happened, and I don't know the exact numbers on this, but we had turnover of probably, I want to say close to 75% of our bedside nursing staff. And that made my job exponentially more difficult, because bringing in a whole set of new nurses to take care of extremely sick and complex patients, even more so, I started becoming like a babysitter of these patients from the bedside nursing perspective, and also an educator of the bedside nurses to having to do my job as well. So it's been really hard, the turnover. It's been hard on everyone. So I think just the increased stress of everything and the intensity of the environment and everybody, just snapping at each other all the time and being angry, it becomes a lot after a while, and the patients can be really acute. So if you're the type of personality that's like ready for that, I think that you're probably a little bit harsher of a personality in the first place. So it's just a lot of us together, like, going at each other. So.
Well, I think you bring up a really good point. And obviously, when I became a mother, I faced some of the biggest hardships in medicine. And that's actually what led to me to start my social platforms. And you just touched upon that. And I think that's what I talk about also as Pinnacle being a community of women, because that's something we face that men don't totally understand. Mm-hmm. And leadership is a lot of leadership at these hospitals and employed practices are men. And so maybe you can touch upon that a little bit more. What do you think changed so much outside of just, obviously being tired because you're a mom, but what do you think you started to notice in the workplace that maybe you didn't notice before you had children?
Oh gosh. I mean, there were a number of things. I would say, I think as much as I don't want to admit this, I think there became a divide between people who do have kids and people who don't have kids. And, our family situations are all different, but the main thing that I was just blown away from was like the lack of understanding on any front of like needing to leave a little bit early, or like, needing a weekend off, or adjusting the schedule to meet the needs of your children. And I don't mean like turning it upside down. I mean just little tweaks here and there that were very feasible were not like, people were extremely rigid over it and like judgmental. And that became really hard because, obviously, like a lot of us, especially me, and I know a lot of nurses are people who don't want to disappoint. We don't like to ruffle feathers. We really just want to go there, do a good job, and like disappointing management or our superiors does not feel good. Like, as tough as we try and be, like, we want to be good employees, and sometimes, and their definition of a good employee, I should say. So sometimes when you're like coming to work and your kid is sick and you have to call out last minute or find somebody to cover for you, it's like a horrible inconvenience, when in reality, like, people will cover for you. At least in my job, the switches aren't that hard to make, but it was being treated as if it was like an act of God, to change things. And mostly, I think, because some of the people making the decisions either didn't have kids or, they were parents who had a ton of support, like 2 sets of functioning grandparents, full-time nanny, that sort of thing. And the majority of the people that I work with don't have that. So it makes like a huge difference just being understanding of the perspective of a mother, period. And I don't think until you've been there, and I can't blame anyone for that because I was that person too, So it's like there's just so much to it, and if you live in a society and work in a culture that has no idea and doesn't welcome it, then you do seem like a pain in the ass whenever you need to call out or change your schedule or, this and that. And so I think that is what I have noticed the absolute most since having kids. And then also, in my particular area, I've gone through a lot this past year, losing my mom and just watching my dad age and stuff. And I just see what's like really important in life. So I have seen that over the course of almost 15 years now in the ICU. And that's, before I had kids, it's what made me very grateful to be here and be healthy and functioning and have what I have. But now that I have kids, it makes me want to be with them, or gravitate toward them. I don't want to be with them all day, every day. Don't get me wrong. But I want to be there, when they go to bed at night the majority of the time. So,
I think, you're making a joke of it, but that I think is a struggle that a lot of women have, is like, being in healthcare is our identity for so long, and we obviously love it. We've trained for it. We've, eat, breathe, sleeped it for so long. Mm-hmm. But when you have children, you want both. And I think most of us, I can admit that on Sundays, I'm really looking forward to adult interaction at work, even just a cup of coffee. I know we don't have water coolers that we stand around, but like, I want that adult interaction. I want to get dressed and like not my sweats. To me, figs are like getting dressed up, big scrubs or whatever. Yeah. So I really enjoy that. So it's really hard, I think, for women, working women in general, but especially in healthcare, that it was your whole identity. You now have to reshape your identity, and there's really no support for it. So what advice would you give to pre-kid Danielle LeVeck? And what would you give advice to other younger nurses that are thinking about starting a family, and even young physician women who are thinking of starting to have kids, because our careers are all taking off at the same time?
Right. Yeah, I think advice I would give to myself is just to know that the likelihood of me being able to achieve more academically and also achieve as a mother at the same time is probably one of them is going to have to be on hold. I think there are some people who can quote unquote do it all. My brain is not designed for that. I'm finding out I'm not the type of person that can publish 5 research studies, every 6 months and get funding grants and, learn new procedures at my job. I'm more of like an all or nothing person in every aspect of my life. And I think that used to serve me very well whenever I was just doing one thing. But now, since I have kids, I just wish I would have known that like it was okay to cut back on my work beforehand, to expect that, there's no downtime, It's going to be very difficult. One of my kids is very difficult. We talk about it all the time. I had no idea I was going to birth such an insane child that changed my whole life, you know? And now I know it's not me because I have two. So the second one isn't like the first one at all. But yeah, I think I wish I would have known that. And I wish I would have known that, like, it's okay to, like, take a pause somewhere, you know? I can't go balls to the wall and, like, you know, my job and being a mother. And, you know, now I honestly know that it's okay to be more present at home and give up a few things at work as long as I'm, like, being a good clinician, you know? So, but that's taken me over 3 years and a lot of, like, mourning that I'm still in the process of giving up because it was such a huge part of my identity.
Yeah, we talk about that at Pinnacle often, is that, you know, you can't be all the things to everyone all the time. And you can have it all, but just different kind of seasons and even day to day. You know, maybe one day you're super mom and the next day, you know, you don't get home till really late and you've barely seen your children, but that's just how we kind of all make it work. Right. So I want to switch gears here and talk about cardiac surgery intensive care unit. Tell me about the culture, because again, our listeners, I want to sort of impart to them how it is for the team in these high intensity environments. So to talk about what the culture is like there and your interactions with the surgeons, the physicians, the other nurses, the other staff there.
So this is about let me think. So 1, 2, 3. This is about the 4th cardiac surgery ICU that I have worked in. And they're all the same, just on, like, a certain spectrum. I'm probably at the highest level of intensity now, just because we're such a huge volume facility. And notoriously, it can be great and it can be terrible sometimes. And I think because honestly, you're working with a lot of egos on a daily basis. Some people are honestly completely normal, functional human beings with just a tad of crazy, because you have to be a little crazy to be a cardiac surgeon. And then some people are just completely nuts and you don't even know how they've, like, made it to cutting hearts open for a living, you know? But with that being said, I think that it starts there. I think that that's the top of the pyramid, is the surgeon. And then, you know, the certain personalities that are attracted to working in this environment. Everybody comes in, doctors, nurses, NPs, PAs, feeling like they have something to prove, you know? And I think that it's to prove to themselves. And no matter what you say, like, yes, you like it, but there's a reason that you're attracted to it. And so it's high intensity, it's complex. People are, at least in the area where I work, people are coding, dying a lot, you know, needing mechanical support. And there's something within you that attracts you to it. And if you can't sort that out, as you can imagine, the compilations of ego can create just a huge disaster of an environment. So I will say it ebbs and flows. Sometimes I go to work for, like, months at a time and I feel like we're all functioning very well as a team. We're getting along very well, but it only takes one person to completely destroy that. And I'm speaking in dramatic terms because it does feel like a very dramatic environment when you're there, you know? So, yeah. So anyway, I mean, it's just like a ping pong ball bouncing around, you know, a billion different directions in a room whenever I go to work and sit every day, and constant questioning, constant monitor beeping, constant stimulation. And I think you just, like, learn to like it. Now, I will say some cardiac surgery ICUs function in a more organized fashion. And in my experience, that has been because it's a smaller amount of beds, a smaller number of cases, you know, slower turnover. And I think that type of environment can be more organized with more defined roles. But there are days that mine is just like a free-for-all, you know? So it really just depends what's going on the day, and who you're working with on the day.
So I can tell you from a medical perspective, meaning from medical school, we were not taught a lot about the team. We were not coach talk. There's not a lot of high EQ going on about how to manage teams, how to be part of a team, how to do that. I at least not for me. Is there that in nursing school or in your training, or
No.
do you?
No.
I think that would be really important. I don't know. The real world requires you to work on a team with other people, and you really have to trust each other. And like you said, sometimes it's high functioning and sometimes it's not. I don't know what your thoughts are on that, or how we can move forward in like medical culture of really being about the team.
Yeah. I think, the biggest problem, I think honestly, it's difficult sometimes for physicians and NPs or PAs to work together, because no matter what you want to say, like, our jobs in some areas of practice overlap a lot. I'm not going to perform orthopedic surgery like you, but in ICU management, I mean, my job overlaps a ton with the ICU physician that I work with, and so if either the nurse practitioner or PA has, some like complex about them or vice versa, then those heads are going to clash. Because I think what I run into is, like, I've been doing this for a really long time now. And, like, unless you're doing specific training in cardiac surgery ICU, doctors aren't coming in with cardiac surgery ICU experience, So there's always like a learning curve, but me and the other NPs are the constant that have been there for years and years and years. So it's kind of hard to have somebody come in and, take over what you're doing. But then again, you see it from their perspective, where they've done all this years of training and hours and, grueling work as well. And of course, they've got to come in and get experience. And, a lot of doctors, I think, feel like, probably haven't had any experience working with nurse practitioners as well, or advanced practice providers, and have opinions about us or don't like us in general. And it's a difficult environment. So I think that once that all gets straightened out, and honestly, it does. Like, I watch it all the time, because there's always new doctors coming in. In my area of practice, the nurse practitioners stay a long time. So we're always there. And there's always like some growing pains the first 6 months. And then after that, everybody gets along just fine. Like, you develop a mutual respect for each other. And that's when things get far more enjoyable than in the beginning, No,
that makes sense. So it's kind of like almost learning each other's personalities on the job and getting used to the team. I would like to see a future where women support each other in healthcare. And because what I've noticed outside of medicine, at least, is that men always support each other, no matter what.
They do. They absolutely do.
They are not each other's enemies. They do not feel that there's only room for one man at the top. That's not part of their thinking. And there's little power struggle amongst men in the C-suite. And I do feel there is that underlying issue within women, definitely in corporate America, but even in healthcare. I can tell you, as an orthopedic surgeon in a male-dominated field, I was definitely treated different by the nurses than my male counterparts. Mm-hmm. And of course it used to upset me, but I've also kind of thought of it like, okay, I got to work on this for our future, for future of healthcare teams, because there are more women going into medicine and there's just more women in the workforce. So I would love to see that happen. And I think that is also why I am so happy we're talking about this, because I think there needs to be an awareness of it first. I think when you're a physician, you come in thinking, I'm the boss and mm-hmm. I know everything. And that's just not the case. I think we could do a better job of teaching people what even a nurse practitioner is versus a nurse. So I'd like to switch to that now. Tell me sort of the training paths for nursing. And I know there's so many, but maybe you can kind of break it down for us so we can understand a little bit better.
Yeah, so there are a lot of training paths, and I think the rest of the nurse practitioners that you speak with will agree with me. I'm assuming you're speaking with like good nurse practitioners, Yes. I don't want to put myself in the block as being good, but I do just fine. And like, I went to a very reputable program. I had reputable clinical hours, very good experience prior to going to NP school. So, I do not agree with most of the online programs and the direct entry programs. I mean, they're okay, but if you're going to really do something, you need the foundation of the nursing education and clinical experience to build upon, to have nurse practitioner school build upon. So usually what people do is they either go directly into college when they're like the ripe age of 18, go through a nursing program, which is 4 years. It can be a bachelor's degree, or there are some associate degree programs as well. Both nurses can take the NCLEX, which is the certification exam, upon graduation. Now, there are also LPN nurses, which typically work in, long-term care facilities, nursing homes. There are still some in the hospitals, but the jobs are fewer and far between. They can they can assess patients and they can pass medications. But that's a different board certification exam, and it's not as comprehensive as a registered nurse. So once you become a registered nurse, there are all different types of advanced practice nurses. There are clinical nurse specialists, which I have my clinical nurse specialty certification, but it's because my college offered it. There are more clinical nurse specialists in the military, and I went to a military friendly college for my doctoral degree. So a lot of the nurses in the military were going to grad school at University of Maryland, where I went. So I had a dual program, because when you go back into the military, unless you're in the Air Force, you are a clinical nurse specialist, but you operate like a nurse practitioner. It's very confusing. And then I'm a nurse practitioner. You can be a nurse practitioner in the Air Force, obviously, but most people are more familiar with the nurse practitioner role, I think, than the clinical nurse specialist. But when I worked in Oklahoma, the clinical nurse specialist did what the nurse practitioner did as well. Because the programs are very similar. You just have to do like another set of clinical hours to be board certified in both. So because nurse practitioner school does not have that many clinical hours, I did 1,000 clinical hours, but it's 500 clinical hours to graduate with a master's and become a nurse practitioner. That's not very much, and it's all very generalized. And so when you get out of school, you need to go somewhere that is going to teach you, or have, having the experience before was great. It was such a help to me. But I walked into a relatively welcoming environment where I had very experienced people to go to, ask questions, be taught. And I feel really fortunate for that based on like some of the things that I hear from other NPs. But it's important to, embrace the NPs that are coming into. I mean, hopefully they're not complete assholes or something, it's like, you don't want that. But I am just like so lucky to work with the physicians, the NPs, the pharmacists that I work with who have taught me so much on how to manage this patient population. And I truthfully believe that that's what being a nurse practitioner is. And I think that if you can come in and be humble and be honest about the educational path that you've taken, and know that you're going to have to come in and do some learning to be functional, to manage a patient population, then, everything should go fine as long as you're open to learning, you check with people, you don't step outside of your, what and do. And so basically that's how I got to where I am. Now you can also be a nurse anesthetist, CRNA, what else? A nurse midwife. Those are the 4 advanced practice nurses: nurse practitioner, CNS, clinical nurse specialist, nurse midwife, and CRNA. So, but you have to be a registered nurse first, however you get there.
Okay.
Yeah.
All right. That makes sense. So let me ask you this. What is one thing you want to see changed in your profession over the next 5 years? From your experience, and also kind of, post-COVID, what is something that you would like to see change?
As far as a nurse practitioner, I would love to see these nurse practitioner mill schools be shut down. I think it's completely ridiculous. I don't know how they get away with it. I think the ANA should shut them down, but I think it's all about money, and they probably just, let it happen, which makes my profession look ill-prepared and dangerous. And I hate that, But so for the nurse practitioner perspective, that's what I would hope. From the nursing perspective, I just wish that bedside nurses would be developed. I wish they could receive training again. I wish that staying for over, 3 or 4 years at the bedside wasn't completely unheard of. Most of the nurses I work with are gone in 1 to 2 years to some sort of advanced practice profession. And I hate that. I mean, I want them to be able to, expand their education and do what they want to do. But a lot of the reason that they're leaving is because they can't stay at the bedside, like mentally and physically, they can't stay at the bedside. And I think that will never change unless hospitals invest in them and give them education and tools to make them feel more comfortable in what they're doing, and directly preventing some sort of, early burnout with them, and also giving the mental and emotional coping skills, because being a bedside nurse and a nurse in general is extremely hard. It's pretty much thankless for the most part. You're never going to get glory. You're never going to get a pat on the back. I think a lot of physicians feel that way too. I mean, I have a lot of physicians in my family. It's just healthcare in general. Nobody is going to praise you as a hero. And that hurts when you're dumping your everything into what you're doing. And I think that the nursing population is just getting really tired. And also this new generation is just not going to put up with it. They don't suffer, they don't want to suffer. We have suffered a lot. And I think that I'm pretty comfortable with suffering. I definitely know when to stop and when to check myself, but I'm okay with it for something that I really love to an extent. And this generation isn't going to do it. So I think that there needs to be some sort of coaching on how to get them through this mentally and physically, and then also expand their knowledge base, And I've recently mentioned to some of the nurses that I work with what my training was when I was a bedside nurse, and they confirmed that they get absolutely zero of what I got. And so it's just sad, it's really sad. So I would love to see that change somehow. I don't know how it will, but I guess
it has to, because I think it's what we're facing as physicians also. I mean, not a lot of people go into primary care anymore because it's a thankless job, as you said.
Yeah.
And this new generation, I mean, resilience is a bad word now. And how do you teach grit and endurance? That's something that was so different from when you and I trained than now. And look, I think there's some good things of it too. I think
for sure.
Our mental health took a back burner and we didn't pay attention to it. So I think that we have to sort of meld the old way and the new way. And part of that has to come from the bigger system of it. Leadership, the hospital, they have to have a stake in this. Otherwise, we're going to lose everyone. I mean, I live in the Bay Area. There's nobody's in healthcare here. I mean, why would you if you can get a job at Google or Facebook and have really amazing free lunch and, have a happy hour every day where they bring beer to you. I mean, that's not something in healthcare. I mean, it starts in the most basic things, right? Like we don't even get fed properly. Our cafeteria for the nurses and doctors, old sandwiches that have been sitting there
gross.
It's so gross. Exactly.
It's so gross.
And so you talk about this new generation, they're not going to put up with that. Why would you do that?
No.
So I think we have a problem in healthcare in general, which is why I also really want to see this Pinnacle community kind of all of us tackle that together, because I think we are stronger in our numbers. But, Danielle, it's been lovely to have you. And I know we barely scratched the surface on a lot. I do want you to touch here a little on your social platform. And because I know you do a lot of education, you kind of make this mix between talking about your personal life and your own struggles and advocacy for nurses, but you also talk a lot about, or you have a lot of educational material. Can you tell us a little bit about that?
I do. So lately I've been talking more about my personal life because that's just, I'll just tell you anything about me, hopefully I haven't gone too far with some of what I've said. I always mean it from the best place, honestly. So if I offended anything, I hate, talking about the doctor, nurse practitioner thing is tough because I don't ever want to offend anyone with what I'm saying, but I think that we could get really far if we just had some truthful conversations.
We have to have reality over it. We have to have some reality to it. Correct.
Yeah. Like respected each other as people. Like, I think it starts there, and then we can be a great team. But, but overall, I just talk about my life and it makes people uncomfortable sometimes, but I think for the most part, it makes people feel seen. And then when I'm not talking about just my personal life, I do some cardiac surgery and ICU education, which I'm getting ready to pick back up on significantly again. So, I've kind of just decided that if I talk about nurses needing education and seeing the need for what the nurses that I work with, what their need is, then I need to start making the education since I've worked in it for so long. So I'm going to make some more formal education, but I have a bunch of TikTok videos and Instagram videos of just tidbits that I share on
Great.
my
So
platform.
So where can people find you?
Oh, mostly Instagram, Nurse Abnormalities, and TikTok, Nurse Abnormalities.
Okay.
So.
And then I'm going to leave you with one last question. I know you haven't been to Pinnacle yet, but we are hoping that you will join us this year. We've already given you the dates, and we really would love for you to be there. But what would be your Pinnacle pearl to share with other women in medicine, nurses, physicians, anybody part of the healthcare team?
I think that in general, we are all going through the same thing or something similar, depending on, we're all in our own role, but I really think if we sat down and talked to each other, whether it's a nurse practitioner, a nurse, a female physician, and I think that we are all going to have facets that overlap of what we go through. And I think that we have so much to learn from each other. Like what I have learned every time I sit down and talk to you, to Natalie, to Katie Duke, anybody, I always learn so much from you all. And our conversations, I value so much. I just spoke with you in Los Angeles a few weeks ago. I'm still thinking about the time that we had together, several weeks later. And I just have so much respect for people. And it's just, I think that if we could all realize that, then, our lives and our careers would be better. So I think that would be my highlight as of now, being put on the spot since I did not prepare. That's what first comes to mind
No,
when I think
perfect.
about things.
That's perfect.
So,
I have valued all of my conversations with you so much. It really, I meant it when I said this to you and Katie and Natalie as well. This being on social media, it sounds so cheesy, but I've gotten to meet so many amazing people that I would not have otherwise met because
Same.
we're all stuck in our own little jobs and our own little crews of people. And just like the cardiac surgeons, the orthopedic surgeons have some of the same issues. And they're my field of people, but
of course,
they're a little cray-cray. So I sometimes need that reality check and to chat with other amazing, brilliant women like you and Katie. And so I very much have appreciated that. But thank you so much today for joining us and being our first nurse on our podcast.
Thank you.
And I hope to see you soon.
Oh, yes. Likewise.
Thank you for listening to the Pinnacle Podcast, where we strive to elevate the voices of women in medicine and inspire excellence across the healthcare landscape. Until next time, keep reaching for your pinnacle.